team effort to deliver a baby, and until you have all those parts and pieces, it's not really a good idea to do something that you can't do.
That's why mothers in Danville haven't been able to give birth in their own community since October. A lack of providers forced OSF Sacred Heart Medical Center to close its birthing center, but plans to open it back up are now in motion. Good evening, I'm Brandon Morano in for Jennifer.
And I'm Jessica Coons. In order for OSF in Danville to offer labor and delivery services again, they say they will have to close their unit in Urbana. Tonight we have new details on what families can expect come September. WCI3's Scarlett O'Hara joins us from OSF in Urbana. Scarlett, how are they supporting patients through this transition?
OSF is launching a hybrid model of in-person and virtual care. For example, patients could meet with a doctor online every other visit during their pregnancies. But when it comes time to give birth, those planning to do so here in Urbana will either have to switch to Carle or travel to Bloomington or Danville.
Our staff, certainly within the hospital, is very excited to get back to business in OB.
OSF Healthcare plans to reopen its Danville Birthing Center in September. By the time that happens, nearly a year will have passed since it shut down.
We never intended it to be a long-term closure for the Danville market. There's a lot of mothers and babies being born in this community every year.
Since October, OSF Sacred Heart Medical Center President Ned Hill says they've done everything they can to connect expectant mothers with other providers and transportation options, but the nearest alternative in that network is 30 miles away.
It's still a challenge because babies come when babies are ready to come, and so we had to take care of a few mothers in the emergency department, stabilize and transfer and so forth.
He says the deciding factor was losing all of their providers in a short period of time, part of a staffing shortage hospitals are facing across the country.
We have the staff, we have the facilities, we have the beds, we have the equipment, supplies, medications, but no one to actually do delivery. You can't have a unit without the doctor.
In order to reopen, they'll need some help from OSF Heart of Mary in Urbana, which plans to close its labor and delivery unit to fill what President J.T. Barnhart called a huge need in Danville.
The goal is those patients that want to stay within OSF would have Danville or Bloomington as an option within the OSF ministry.
Neither he nor Hill are concerned about capacity. Barnhart says Heart of Mary has 25 labor and delivery beds, and there's an excess of 40 beds across Champaign-Urbana. When asked whether Urbana's unit will be closed permanently, he says time will tell.
But I would say that things are always changing in healthcare, and we'll have to see where it goes.
Barnhart says those staff members here at Urbana will have priority over the positions opening up at Sacred Heart. And over in Danville, Hill says while staffing remains a concern, it shouldn't get in the way of his goal of opening by September. Reporting live in Urbana, Scarlett O'Hara, WCIA3, your local news leader.
All right, Scarlett, thank you so much. Both OSF presidents say they're working closely with Carle Health through this transition. Before Danville's birthing center closed, both OSF and Carle providers worked in the unit. Right now, Carle's vice president of Women's and Children's Services says they are prepared to absorb the volume of deliveries happening at Heart of Mary just down the street in Urbana. They have 23 total beds with anywhere between 2 to 12 occupied at a time.
We, of course, stand ready to care for any patient that crosses our threshold, whether they have established care with a Carle provider or not. That's part of, the care that we provide is meeting the needs of those patients.
She says Carle also has the only level 3 perinatal center in the region, meaning they can take care of the sickest mothers and babies in the same facility.